Good morning, and thank you for this opportunity to share with you my understanding of key elements of the Israeli healthcare system. Over the past 30 years, I have been extensively involved in cross-national learning in healthcare, mostly between Israel and the United States, and secondarily between Israel and Europe. This has entailed writing joint articles, organizing binational symposia, and planning study visits. I am delighted to have this opportunity to begin to interact with Chinese health and business professionals. I hope it will be the first of many such interactions, both here and in Israel. My talk is organized into three parts. First, I'll be giving you an overview of the Israeli healthcare system. Then I'll share some selected comparative statistics underscoring the Israeli health system's efficiency. And third, I'll share with you what I consider to be 7 vital ingredients which contribute to the efficiency of the Israeli healthcare system. The first component of the healthcare system is universal insurance coverage. All Israeli citizens are covered through a government-run national health insurance program. The government also specifies the list of services to which all citizens are entitled. This is called the benefits package. This system was put into place approximately 20 years ago. Second, the system is financed primarily via progressive taxation. Those who earn more pay more. The monies are raised via an income tax and a special health tax, both of which are progressive. This means that the higher the income level, the higher is the proportion of income paid in the tax. The third building block is that care is provided through 4 competing nonprofit health plans. The government does not provide the care directly, even though it is the one that collects the money. Instead, the care is provided through 4 large non-governmental organizations, which we call health plans. Each citizen is free to choose from among the 4 plans and to switch plans whenever he or she wants to do so. The government takes the monies that were raised for health insurance through the tax system and distributes those monies among the health plans based on how many people joined each plan and their age mix. This means that the health plans get more money for members who are elderly than for members who are working age, even though the working age members in general pay more money into the system through their taxes. The health plans are then responsible for making sure that all their members have access to all the services that the government has determined as being in the benefits package. The health plans can provide the services themselves or pay for some other organization to provide some of the services. These health plans are big, well-run, and very efficient organizations. They range in size from almost 1 million members to 4 million members. They are hierarchical organizations with national, regional, district, and clinic level management. This enables them to combine strategic direction from the top with a lot of room for innovation and flexibility at the local level. The fourth building block is a mix of governmental and non-governmental hospitals. About half of the acute care beds are owned by the government, about 1/3 by the health plans, and the rest by a mix of smaller non-profit and for-profit organizations. So to review these 4 key structural elements, we have universal insurance coverage, financing via progressive taxation, the care is provided by 4 non-governmental health plans, and we have both governmental and non-governmental ownership of hospitals. Now I'll turn to some key statistics. Israeli healthcare is considered to be among the most efficient in the world. There are several systems for doing these rankings, and the exact place of Israel varies from system to system. But for example, in the latest Bloomberg rankings, Israel came in 3rd, behind Hong Kong and Singapore, and just ahead of Spain and South Korea. In the next set of slides, I'll be showing you statistics that contribute to that high efficiency ranking. In this slide, we see that in Israel, the share of GDP accounted for by healthcare is much lower than the US, and it is also lower than that of the UK and Japan. As we see in the next slide, the difference in dollar terms is even greater. Nonetheless, life expectancy in Israel was the second highest of these four countries, and Israel also looks comparatively good on other key health status measures, such as infant mortality. This raises the question, how does Israel achieve such good outcomes at such reasonable cost? I'll be sharing with you what I consider to be 7 vital ingredients that have contributed to Israel's efficiency in healthcare. First, a combination of centralized government financing and non-governmental delivery. Centralized financing enables the government to decide overall how much money will be coming into the mainline national health insurance system. It will weigh investment in healthcare with other important uses of governmental funds, such as education, housing, road systems. In addition, once the amount of money is decided that will go into healthcare, the government has a very thoughtful and structured process for prioritizing how the money within healthcare will be used, particularly when it comes to new technologies. Each year, there come on the market many new medications, many innovative medical devices, and no country can afford all of them. Certainly in Israel, we can't afford all of them. So we have a system in place for weighing the pros and cons of these different new technologies and then deciding which of them will be included in the basket and which will unfortunately not be able to be included. So those are the benefits of centralized financing. There are also important benefits of non-governmental delivery. This enables us to benefit from the initiative and energy and creativity at the delivery level. Now, even though much of the delivery is non-governmental, it takes place within a regulatory framework. We have the benefits of competition and regulation combined. So the government might decide which services will be provided, but it leaves it to the health plans to decide how they will provide those services, what to make and what to buy, what mix of health professionals to employ, and so on. The third vital ingredient is that Israel is a leader in effective use of health IT. It begins with the fact that all of our primary care physicians have electronic health records, and they have systems that were put in place by the health plans with whom they work, and everyone has a computer with access to the records on their desk. Moreover, we now have health information exchanges that link information from the hospitals and the health plans, so that, for example, if a patient comes to the hospital unconscious, the emergency room physician can nonetheless check his record and know if the patient is sensitive to any medications. Increasingly, the health plans are putting into place member or patient portals, making it possible through the internet to make appointments, view test results, and even to some extent communicate by email and other methods to their providers through secure personal health accounts. And we're also seeing more video conferencing, so that, for example, there can be a video link between the elderly person who is homebound with a nurse sitting in the health plan clinic, and she can both have a visual sense of how the patient is doing and also provide guidance through visual techniques of the types of self-care required. Now, a lot of this capacity of Israel as an effective user of health technologies, a lot of it is due to the fact that we in Israel have this very well-developed system of digital health and health IT companies, startups and other companies. There's a real synergy between the health system and these companies. On the one hand, by having a well-organized health system in place in Israel, these companies can have a better understanding of what the needs are and how digital health can help, and also as well as built-in laboratories or accessible laboratories for testing out their new products. Similarly, the health plans benefit and hospitals benefit from having this infrastructure of high tech in Israel, because they can get relatively easy access and can also influence the development of new products. A fourth vital ingredient is our strong system of primary care. We have very broad geographic coverage, and almost everyone in Israel lives quite close to a primary care provider. We also have relatively short waiting times for primary care. In fact, a recent OECD assessment of healthcare in Israel found that the primary care in Israel was among the finest in the world and could be an important model for many other countries. We also benefit from a well-trained, well-organized, and reasonably well-paid cadre of primary care physicians. The fifth vital ingredient is an ability to set strategic goals and mobilize accordingly. Sometimes this is done through top-down directives, when the government has to really take, in a sense, control of the health system, such as when there's a terrorist attack or if a massive outbreak of a disease. But usually, the coordination is done on a voluntary basis. And so the government might identify a need, but then it works together with the other players in the health system to figure out how to mobilize around that. So, for example, the government and the health plans together identified the need to monitor and improve the quality of care in primary care. This was about 10 years ago. And then they worked together on setting up the data systems and the reporting mechanisms to help make that possible. A sixth vital ingredient is the alignment of incentives. In our country, because the physicians are largely paid either on a salaried basis or a capitation basis, they share with the health plans and the hospitals an interest and desire in giving good quality care, giving good service to the consumers, as well as keeping costs under control. This is in contrast to the situation, let's say, in the U.S., where most physicians are paid fee-for-service, so they have always have an interest in providing more care, even if the organizations with whom they work have an interest in constraining expenditures. The seventh vital ingredient is an ability to adapt innovations from other countries. When I first came to Israel 30 years ago, I was very impressed that people in Israel were constantly asking themselves, when they faced a challenge, they asked themselves, how is this being done in other countries? And often they would even travel to other countries to see what's happening there, or they would invite experts from other countries to share with them their knowledge. This was very different from the country in which I grew up, the United States, where the approach, at least then, 30 years ago, was that we really can't learn much from other countries. We're so different. We're a large country, but you can learn from other parts of our own country. No need really to invest a lot of energy in looking elsewhere. So in Israel, yes, we do look to other countries for ideas. One of my current projects is to collect examples of this. I've been meeting with chief executives and other senior executives in the government, in the health plans and the hospitals, and collecting from them stories of cases in which they personally were involved in learning about innovations in other countries and then adapting them to Israel. And it's really very striking. Almost every senior manager in Israel has a story like this of where they were involved in adaptation. These issues cover perhaps many of the most important issues in Israeli healthcare. Now, of course, we don't just do a copy-paste when we see something in another country. Obviously, health systems differ, cultures differ. So a big key is not just identifying a basis, an interesting idea from another country, but figuring out how to adapt it to the needs of our own country. And one of the things that makes this whole learning possible is a combination of humility and chutzpah. Chutzpah is a Yiddish Hebrew word meaning sort of boldness. So what this means is that people in Israel tend to have enough humility to say we can't do it all on our own. We need to look to other countries for ideas, but yet the boldness to feel that we don't have to do exactly the way they did it there. We are the ones who are in the best position to figure out how to adapt that innovation to our own culture and health system. This slide summarizes the 7 vital ingredients that I discussed: a combination of centralized government financing and non-governmental delivery, a combination of competition and regulation, leadership and effective use of health IT, a strong system of primary care, an ability to set strategic goals and mobilize accordingly, alignment of incentives, and an ability to adapt innovations from other countries. These are some of Israel's special ingredients. As I stand here with you in Hangzhou, I'm curious. What are the Chinese healthcare system's special ingredients? What are its special strengths? I hope that later today, and in the weeks and months ahead, some of you will reach out to me to share your perceptions of Chinese healthcare's special strengths. In addition to directing a health policy research center, I am also a journal editor. Our journal is dedicated to exploring what Israel can learn from other countries and what other countries can learn from Israel. I am pleased to report that we recently published our first contribution from China, which you see here on the slide. And we look forward to many more contributions from China in the years ahead. Thank you very much.